If you are preparing for your NCLEX exam or even maternity exam in nursing school, these are the major OB complications you must be able to recognize and manage quickly. The first one is postpartum hemorrhage. Postpartum hemorrhage is the most common cause of postpartum death. It is characterized by a boggy, soft uterus that fails to contract, excessive vaginal bleeding that soaks pads within minutes, and early signs of shock such as low blood pressure and a rapid heart rate. The first action is always to massage the fundus to help the uterus firm up. Assess the amount of bleeding, administer oxytocin as ordered, and make sure that the bladder is empty to allow the uterus to contract properly, and notify the provider if heavy bleeding continues despite interventions. Now the next one is preeclampsia and eclampsia. Preeclampsia is a serious hypertensive disorder that can quickly progress to eclampsia, which includes seizures. It presents with elevated blood pressure that continues to rise, proteinuria, or worsening edema, and neurologic symptoms such as persistent headache or visual disturbances like blurred vision or seeing spots. Eclampsia is identified by the onset of tonic-clonic seizures, severe headache, and marked visual changes before the seizure, and hyperreflexia followed by confusion or disorientation after the seizure. Administer magnesium sulfate to prevent seizures. Monitor for magnesium toxicity by checking respiratory rate and deep tendon reflexes. Initiate seizure precautions. Manage blood pressure with prescribed medications, and prepare for delivery if maternal or fetal status deteriorates. The next one is shoulder dystocia. Shoulder dystocia is suspected when the baby's head delivers and then retracts like a turtle. Labor stops progressing despite strong contractions, and the fetal heart rate distress, often with late decelerations. Place the patient in the macrobat's position to widen the pelvis. Apply suprapubic pressure to help free the fundus. Communicate clearly with the provider and prepare for additional maneuvers if necessary. Then lastly, we have cord prolapse. Cord prolapse presents when the umbilical cord slips through the cervix before the baby's presenting part, which cuts off oxygen to the fetus. It presents with a visible or palpable umbilical cord in the vagina, sudden fetal bradycardia, or deep variable decelerations, and a change in the fetal presenting part immediately after membrane rupture. Place the patient in knee chest or Trendelenburg position to relieve pressure on the cord. Use sterile gloved hand to lift the presenting part of the cord and keep your hand there until delivery. Administer oxygen to the mother and prepare for an emergency C-section. If you need a study guide that breaks down emergencies like this into step-by-step nursing actions and the top tested areas on the NCLEX, get our NCLEX Predictor study guide by visiting our TikTok shop.